Fantastic. I think we'll make a start now. Can everybody hear me all right? Maybe somebody could wave at me if they can hear me. Excellent. Lovely. So hi everybody, and a really warm welcome to the first webinar in our series about using patient data in research. So I'm Miranda. I'm a kidney patient myself, and I'm the patient co-chair of the UK Renal Data Network, along with my clinician co-chairs, Samira Bell and Nigel Brunskill. And the network has organised these webinars, which are very kindly being hosted and supported by the research team and the PPIE team at Kidney Research UK. So thank you very much to all of you there. A little bit of housekeeping. May, if you could move the slide on. Thank you. So just to let you know that this webinar is going to be recorded for anybody who can't attend, or if you want to see it again, it's going to be available on the Kidney Research UK YouTube channel. If you could keep your mics on mute so we don't get any background noise, that would be fantastic. And you can have your camera on or off as you choose. We're hoping to have a bit of time at the end for questions. So please do add any questions you've got in the Q&A section. So not the chat, but in the Q&A. We're not really going to be monitoring the chat. On my laptop, you have to click on more or three dots to find the Q&A bit. And there are subtitles if you need them. So I'm now going to hand over to Aisling McMahon from Kidney Research UK to introduce the webinars and our speakers. So thank you very much. Aisling, over to you.
Thanks, Miranda. And could I also just say welcome, everybody. We're absolutely thrilled that you could join us today for this first webinar about patient data in research. So as Miranda said, I'm Aisling McMahon. I'm the Executive Director of Research at Kidney Research UK. And we're delighted that you could join us today for this first in a short series of webinars about using patient health data for research purposes. So I just want to set the scene in a couple of minutes. And really make the point that as a charity at Kidney Research UK, patients are absolutely at the heart of everything that we do. We value patients' opinions, they contribute to our research decision-making, and we feel that data research should be no different. So we're really keen to have patient input and engagement into the types of data research that we feel, and hopefully you feel, are going to be important to change outcomes and drive progress. So just as an example, patient data can be used to look across populations, to look for patterns of disease, and again, hopefully to change outcomes for patients, but it's impossible to do that on a sample of one person. When we think about rare diseases, it's helpful to gather as much information as possible from as many people as possible to understand disease development. And again, that's the only way that we're going to be able to improve treatments. So as I said, we're a collaborative organisation, and May, if I could just show the next slide, this just shows the list of people that we're working with to help improve our use of patient data. So we're working with our Renal Data Research Network, with our new Kidney Data Science Catalyst, which is something that you'll hear more about as these webinars progress. We have a big biobank, which we call Nurture, that some of you may be familiar with. And again, that's linked to a lot of patients' clinical data and is a really rich resource for research purposes. We work with the UK Renal Registry, which collates all patient kidney data, and RADAR, which is a subset of the registry that looks at rare kidney diseases, all really rich sources of information. And we've recently developed a kidney data portal, which is collating data sets and information about data that's available for researchers to help with their research questions. So this seminar series has got a few aims. What we want to do is introduce the kidney health data landscape to you all, so that you're aware of what's happening and the strides that we're making, the effort that's being put into developing good data research for better patient outcomes. We want to facilitate the understanding of how patient data is used in kidney research. And we want to gather information about your perspectives on the use of data, which is really important to the way that we proceed. And of course, making sure that the data research that's done is done in a secure environment as part of our wider commitment to driving innovation for benefit in kidney disease for patients. So if we just quickly outline this seminar series, that we've got a number of webinars planned. If you've signed up to this series of events, you will get a reminder, so you don't need to write all these dates down now. This first webinar is a general one, so it's applicable to patients of any type. You don't have to be a kidney patient for this to hopefully be a useful session. The subsequent webinars will be a little bit more focused on kidney patients in particular, but you're still all most welcome to join any of those that you feel will be of interest. So on to today's topic, which is about the role of patients in health data research. We're going to keep questions to the end. So we've got two invited speakers and we'll have questions after they've both presented. But please do add your questions to the Q&A function, which is at the top of your screen. You should see it. If you have a question, please pop it in there as we go along. So I'm delighted to welcome our first speaker now, which is Emma Lagerstedt from, I've lost Emma's slides now, from Understanding Patient Data. Emma is the Policy and Engagement Manager, and she's going to talk to us about what patient data is and how it can be used in research. So I'm going to hand over to Emma. Thanks very much.
All right. Hi, everyone. My name is Emma Lagerstedt. I'm one of the Policy and Engagement Managers at Understanding Patient Data. We're a small policy research and communications initiative all about patient data. Next slide, please. Right, so taking it back to basics, as it were, with the question of what do we actually mean when we say health data? So health data or patient data refers to the information about you that is routinely collected when you interact with a health service. So that'll contain things like information about you, like your contact details, your date of birth, your address, the typical sort of demographic information, information about your health, so medical conditions, medication history, test results, but also information about your lifestyle, so smoking, alcohol consumption, physical activity, things that may impact your health, and administrative information. So that can be things like your waiting list status or appointments booked that the NHS will hold about you. And I'm using NHS, and I don't know whether this is sort of UK-wide or obviously in Northern Ireland, Health and Social Care in Northern Ireland. Right, and what is a health record and how is it stored? So I'd like to caveat this by saying that this is sort of the general overview. There are differences in how patient data is managed and governed across the UK. So as you may know, health is a devolved matter in the UK. So certain things will vary slightly between different countries, but the principles tend to be the same. And so what is a health record and how is it stored? So your health record, it'll include information like your name, your address, date of birth, NHS number, medical conditions, all those things we talked about in the last slide. They will primarily stored digitally, though some will be on paper. And different NHS organizations, such as your GP, your hospital, and other services hold their own health records for each patient. And the level of digitization really depends on the type of NHS organization you're talking about. So you'll know when you go to the GP, they'll be typing away on electronic records. And almost all NHS trusts in England have an electronic patient record system. But there's still a bit of a mix. So 71% of hospitals use a mix of both paper and digital. But the ambition is very much to move fully digital. Next slide, please. Oh, there you go. Yes. And who holds health data in the NHS? So, as you may know, the NHS is not an organization as such, but a system of various different providers, a bit of a patchwork. And each of them are responsible for holding, managing, and protecting patient data. However, there is linkage, so there'll be a summary version of your health record, which is held digitally and shared across the system to make sure that healthcare professionals involved in your care will be able to access the important information about you. And depending on where you live, there may be local or regional systems that consolidate records and help share things even more so. And then there are others, such as sort of NHS England in England, that can access parts of your data for certain instances to improve the nation's health. So the national data sets that, for instance, pull information about how many people attended A&E in January. And that's really important to manage the health service, manage demand, understand how we're performing, etc. Next slide, please. And you may know in England there are plans to create a single patient record to finally sort of join all those pieces up, although that's at a very early stage. So what is health data actually used for? So we like to talk about use cases. And so the 4 key ones here are individual care, research, planning, and population health. So the first one being individual care, which the NHS sometimes calls direct care for some reason, is essentially using data to share information between different parts of the service to help manage your care. So sharing information from the GP to your hospital to the pharmacy, for instance, to make sure that they have up-to-date information about the individual to help provide the best and safest care. And there's research and innovation. So as we talked about in the beginning, understanding patterns of disease, trialing a new medicine, all those things rely on the use of patient data to some extent. And then there's service planning, so understanding how healthcare services are working, both at a local, regional, and national level. And that helps us ensure they are fit for purpose and that they're performing as they should. It also helps us manage resource. So for instance, patient data is used to manage capacity at a hospital, but also to, for instance, evaluate how joint replacement services are performing nationally. And there's also managing population health, which looks at data relating to specific groups of people within a defined geographical area to identify common problems and adapt services. So for instance, noticing that there's a high prevalence of smoking in an area and adopting smoking cessation programs to help people. Next slide, please. So who outside the NHS can access health data? So in order to conduct research into diseases and develop treatments or improve health service planning and population health, sometimes NHS data can be accessed by organizations outside the NHS. Protections around the use of patient data hold that access needs to be for a specific purpose in the public interest by authorized researchers or analysts using the minimum amount of data necessary to achieve the outcome. And I'll come on to sort of data safeguards in a minute. So anyone wanting to access patient data must request access from the organization that holds the data and demonstrate that their use of data is safe, secure, and ethical. So as I mentioned, each organization holds responsibility for patient data for their patients and is responsible for ensuring that it's used and shared in an appropriate way. And there are sort of national bodies and teams and initiatives to support these efforts to provide expert guidance on what is and isn't an appropriate use of patient data. Next slide, please. And so a couple of examples of what that might entail. So for instance, government departments, for instance, the UK HSA, the Health Security Agency, which uses patient data to monitor trends in certain infectious diseases, for instance, to make sure that they can respond to a health threat against the country. Pharmaceutical industry researchers who might need to access patient data in order to develop new treatments. Charity or academic researchers. So, for instance, I suppose Kidney Research UK or the British Heart Foundation, or researchers at a university who might need to access patient data for research, as well as other data extractors. So that'll be things like NHS organizations that bring together data, Digital Health and Care Wales, or NHS England, which used to be NHS Digital. And with all of these, thing to bear in mind is that there are these principles around minimizing data, and all the protections that come with that as well. Next slide, please. Another thing to bear in mind is, and how we like to think about identifiability, is it's sort of a spectrum. Because sometimes you hear, oh, your data might be used or it might be shared. But what we're talking about generally is de-identified data. So there's identifiable data. So you'll see here on the screen, which is sort of the full picture, including all identifiable details, which is often known as confidential patient information. And then there's de-identified data, which is where you take out the information that could directly identify you, such as your name, your address, your NHS number, and that'll either be removed or will be disguised, so replaced with an identifier that can't be traced back to you and held separately. Next, please. I'm sorry, there's a lot of information here. But I'm happy to share more information offline, and there's also a lot of information on our website about how data is kept safe. But one way of thinking about how data is kept safe is what's called the 5 Safes framework. And so that's originally developed by the Office for National Statistics, but it's a useful way to think about how data is kept safe. So for instance, safe people involves so thinking about how staff are trained. So staff employed in the NHS must complete information governance training, and there are strict requirements on providers in the NHS to ensure that people maintain high standards and their training. Safe projects and safe data. So there will be, anytime there's a project that involves accessing patient data, there will be data protection impact assessments. There will need to be applications to a health, an ethics committee if it's research, and several assessments would need to be undertaken to ensure that the project is lawful and that it's ethical, that they follow all the principles that we've talked about. Safe data is about what we just talked about in terms of identifiability. So making sure the data has been processed to protect people's confidentiality and anonymity, that it's been de-identified or anonymized. Safe settings, and I'm sure this will be covered at some other point, but it's using things like, for instance, secure data environments or trusted research environments where there are limits on what the researcher can actually access, and that it protects the data so that the only thing that gets exported is the result rather than the actual data. There's a lot of different technical ways that you can manage that. And safe outputs, so checking the outputs of the research. And final slide. I'm not going to go through all of these, but this is just to demonstrate that there really are a lot of different laws and regulations in place to protect patient data. Some of these you may have heard of, some of it you may not have. And there are explainers on our website, which will actually tell you in sort of lay language what they actually do and what they mean. But I think the thing to keep in mind is there's a lot of laws and a lot of regulations in place in order to protect patient data for use in individual care planning, population management, and research. And sorry, that was really, really fast, but I'm happy to take any questions and share any further info. My email address is there, or our email address is there, but I'm sure the team are happy to share that along with the slides later as well. Thank you.
Thanks very much, Emma. That was a really lovely roundup of what you do and how important data is, and great to see those protections in there for patient safety. So we won't take questions now. We'll have questions at the end. So I just now want to introduce Amy Hodgkinson, who is the PPIE manager at HDR UK and also the learning and development lead for PEDRI. And Amy's going to talk to us about PPIE in data research. Thanks very much, Amy.
Thank you so much. I'll just get up my slides. There we go. Hopefully everyone can see that okay. So yeah, lovely to see you all this afternoon. So my name is Amy. I'm a PPIE, which is Public and Patient Involvement and Engagement Manager at Health Data Research UK, and I'm going to be talking about the importance of PPIE in data research, as well as sharing a bit about what we do at Health Data Research UK, as well as PEDRI, which stands for the Public Engagement in Data Research Initiative. So I apologise, there are a lot of acronyms in our field of work, but I'll try and explain everything thoroughly so I'm not just throwing words at you. And I'll start by explaining what I mean by PPIE, as that's probably the acronym I'm going to be using the most. So if you've worked in this kind of field before, you've probably come across some version of PPIE. You might have heard it as patient involvement, public engagement, PIE, PPI, PPIE, lots of different versions and terminology, but it's all essentially working towards the same goal. Which is really that we want to work with public and patients in a meaningful way, share what we're doing with data, how it's being used in research, learn from them, what do they find interesting, what would they like their data to be doing, what changes would they like to see, as well as actively involving them in the research process. So public can often be used as a way to incorporate both public and patients together. Often you'll find in the health space, we say public and patients, as we just want to give that further emphasis to people with lived experience of a specific condition. And when we're talking about engagement, we're talking about information and knowledge sharing. So obviously in this circumstance, we're sharing information about data, how it's being used in research, but we want this to be a two-way dialogue. We don't want to just tell people what we're doing. We want to ask, what do you find interesting? What's engaging here? What can help you understand this further? Is there more you want to know about? This is obviously a complicated area, and from the outside looking in, it can maybe seem intimidating at times. We want to make it as welcoming and accessible as possible because there is a lot of exciting stuff going on with data and research, and we really want to engage public and patients on that. And then involvement kind of builds upon this engagement. So this is where we create opportunities for public and patient to actively contribute to the research process in a meaningful way. So this is about shared decision making, actually shaping how the data is used, be that in a research project itself or being part of the maybe general governance of the charity, an organisation, and shaping it ideally from the beginning, from the idea stage all the way through to the end. So that's really what I mean when I say PPIE, and I will be saying that a lot. So hopefully that's clear what that means. And then the next point is, why is this important, particularly in the context of data research? So as we've already talked about, people and people's lives and experiences exist behind this data. In fact, if it wasn't for people, there would be no data. So it's of moral and ethical importance that the public and patients are engaged and we're transparent about what's happening with that data, how is it being used, and that they're involved to ensure that data is being used in a way that's in their best interest, that's going to have a positive impact and hopefully improve lives. And again, we've touched upon this. We want to make sure the data is being handled in a safe and trustworthy way. And we want to work with the public and patients to understand what is trustworthy to you, what is safety to you, and how can we ensure that's what we're doing. And on top of all of that, we know and we have seen that when we involve patients and the public in research, it improves its quality. It improves the relevance as well as its overall impact, as patients and the public provide this unique perspective that researchers and people so ingrained in this area of work and in their specific area don't see actually all the lives and experiences, interactions with systems, what it's like to live with a condition. All of this really enriches our research and our understanding on a topic. So it's really crucial that we involve people here as well for that reason, on top of the moral and ethical importance. So that's a bit of the what and the why. And I now want to move into the how from my perspective. Why am I here talking to you today? So I work within the PPIE team at Health Data Research UK. Here we all are. And our main purpose is to try and build a culture of PPIE. So we want patients and public to feel empowered to get involved in this area of work. And we want to work with researchers and data experts for them to feel confident to carry out PPIE, bring people into their projects and communicate the work they're doing in a clear and accessible way. So although we all come together as a team, you can see from all the different words under our names, and I actually work across 3 different areas, but I won't go into all of those areas. We go out and we spread out into all of these programs and areas of work that are either led by Health Data Research UK or a link to Health Data Research UK. And we support those programs to involve and engage patients. So one of the areas I'm going to be talking about is PEDRI, and this is where I lead the learning and development work stream. So PEDRI is short for Public Engagement in Data Research Initiative, but I'll say PEDRI from now on. We're really all about championing public engagement with data and statistics. So that actually goes beyond health data. It does include health data, but also administrative data and statistics. But again, it's the same concept of health data, organisations that collect data through their regular activities, just those that are doing it beyond healthcare settings, essentially. And PEDRI isn't just one organisation. We unite lots of different organisations working in this space to be collaborative, to work in partnership and look at how we can improve public engagement in data research, because there are a lot of elements very specific to data research that we want to consider. Our primary audience are public involvement and engagement specialists, experts, organisations within data and statistics, researchers, data experts, but everything we do is co-produced with patients and the public, and we collaborate very closely to look at how we can deliver our work. And a real key aim for PEDRI is building trust between the data research sector and the public, and doing this in a collaborative way so we can make data research as open, clear and relevant to people as possible. And we do that through a variety of ways. So these are some of our key areas of work. Again, I haven't got time to go in depth into all of these areas, but I'd really recommend visiting the PEDRI website. PEDRI has been going for about 2 years now. And in that time, we have grown a lot. We went from 4 founding organisations to now having 18 organisations as part of PEDRI. So very recently, in November of last year, we relaunched our website, rebranded to show all the different things that we're doing. So I'd highly recommend having a look at our website and seeing what interests you. So one of the 2 areas I wanted to highlight, starting with the good practice standards. So these have been developed over the 2 years that PEDRI has been in existence. And it's been a very collaborative project involving the public to create this robust framework for how we can enhance public involvement and engagement in data and statistics. And it outlines 7 standards that really are trying to tackle key barriers to effective public engagement. So just to highlight some of them, we've got equity, diversity and inclusion, data literacy and training, and 2-way communication. But there are 7, and if you go on our website under our work, you can really look in depth at what each standard is trying to achieve. So I'd very much recommend that. And then I will also just highlight the learning and development work stream. Quite selfishly, this is my area of work, but it also means I can talk best to what's happening there. So this is really all about cultivating a collaborative approach where we learn from each other, see what other people are doing. Sometimes we can work quite separately, or we might find there's duplication in this area. So we want to ensure we're coming together, learning from each other and doing public engagement in the best way possible. So one of the key things we've been developing, which you can see on our website, is a resource hub that provides tools, information and guidance for people carrying out public engagement in data research, and hopefully helps guide them and improve their approach. So that's the first thing we've been working on, but there's a lot that we're looking to build on from this. And just to close off the PEDRI section, I thought it would be particularly nice to hear from one of our public contributors, Jan. We were hoping she could speak today, but unfortunately she wasn't available. So she's given me this really lovely quote. She has been so instrumental in the development of PEDRI, and I think just really nicely highlights why our work is important. So she says, our data holds the key to better health, care and improved lives. It can be recycled and used again and again for different research as we have new technologies and systems to help us get a better understanding of using it. Public engagement is vital because it's our data and our lives. Our voices can guide the research and answer our health questions, help the researchers focus on what matters to us. PEDRI is unique and exciting. It brings the public and researchers together in a way that makes sure everyone can take part, be heard, and make a huge difference to data research. It sets the standards for these relationships so everyone knows what to expect, why it's important, and how we can all reach our data research goals. So I thought that was a very nice way and speaks much better than I can to why PEDRI and public engagement and data research is important. And then finally, just the last section, I want to highlight just some of the work we're doing at Health Data Research UK centrally within the PPIE team. So this work is led by my colleagues. So if there are any specific questions, I will do my best to answer them, but can pass these on as well. So I should really say who Health Data Research UK are, as I've been saying that word a lot. So who are we? We are a national institute that aims to accelerate the trustworthy use of health data to enable discoveries that improve people's lives. So we're an independent charity supported by government charity research funders in the UK. And we have a small central PPIE team dedicated to supporting the Inner Institute of Health Data Research UK, and they work closely with colleagues across the organisation. So their mission is really, and you'll see as well how PEDRI is kind of feeding into this, but their mission is to really establish good practices in patient and public involvement and engagement so we can improve research, innovation, transparency, public trust and confidence. And our vision is that all health data research will deliver benefit to diverse people and research and innovation by listening to the needs and concerns of patients and carers and enabling the shared decision-making process throughout research. So hopefully that just gives you a quick highlight of really what we're about. And coming into 2025, we've got 4 key areas that we're looking to focus on. So like I've mentioned, that good practice, those good practice standards from PEDRI, we want to really distribute this knowledge and hopefully encourage people to adopt the standards so that more people are working at that level. We want to foster inclusion and trust through two-way communication, not just telling people what we're about, but asking them what they're interested in, what do they want to know more about, and making it as accessible and inclusive as possible. We want to, through that, be effective with our engagement and diversity, particularly with partnership organisations, working with organisations who already have good relationships established with the public and underrepresented groups. And then finally, through coordination, as I mentioned, sometimes people can be doing different things that might be relevant to each other. So we want to make sure we coordinate and collaborate so we can improve PPIE happening within health data research. And final point from me is, if anything I have said today sounds interesting or exciting, I would really encourage you to join HDR UK Voices. I'll put a link in the chat in a moment, but this is over 200 members currently, of public members, patients, PPIE practitioners, and we regularly send out information and have consultations and discuss where we're moving forwards with PPIE at Health Data Research UK. So if you are interested in contributing to health data research, hearing more about what we do, really welcome you to sign up to this. It's just like a newsletter, essentially. It's very easy to sign up to. And we really, really couldn't do this work without you. If we didn't have the lovely support of our patients and the public, we wouldn't be able to do this work. So please do sign up if it's of interest. And yeah, that's me. I'll stop sharing.
That's fabulous. Thank you very much, Amy. That was a great overview of where we are in terms of supporting people to participate and be engaged in many data activities. And I hope people sign up to your website as well. I think you mentioned one really important thing there as well, which is about representation of lots of different groups of people. And again, that's really important, that data is representative of a patient population. So we encourage people to participate as much as possible. I think we have a couple of questions in the Q&A. So if I just direct these as they're coming in. First question is for Amy. Can I ask, Amy, do PEDRI or HDR UK run any training courses for people interested in getting involved in data research?
Yes, so when we say people, are we talking about public or researchers? I guess that's maybe, but the answer is yes and no. So what we're really looking to do with PEDRI, particularly in the learning and development work stream, is bring together what's already out there. So if you look on the resource hub, there's some really interesting training. And again, this was my question, whether it's for training for public and patients or training for researchers. We have some great training for public and patients that we haven't developed, but we've got up there, that if you're interested, you could go and have a look at, that really gives in-depth insight into how data is used and how data research works. But we're also looking at creating some of our own training to support researchers, particularly early career researchers, to carry out public involvement and engagement. So that's where the no is. We haven't done it yet, but it's very much on our radar. And I think that's really important, both of those sides, training both researchers and data experts, and training for public as well, because it's really about having everyone on equal footing. And that's a real core part of what we're doing in the PEDRI learning and development work stream. So yeah, good question.
Hey, thanks, Amy. And then Gillian had a question that she's posted in the Q&A, and I think this is probably for Emma. Is anonymization an irreversible process? Just for anyone who hasn't seen the question about anonymizing patient data.
Yes, so it depends on whether it's anonymized or pseudonymized. We often use the word de-identified because technically, if you want to get technical about it, you could argue that it's very difficult to fully ever completely anonymize data unless it's aggregate data. So think about sort of the census, that's aggregate data that is highly unlikely to ever be able to identify anyone. Anonymized data typically can't be identified. Pseudonymized data, which is what's typically used for things like research, is hard to identify, but normally the way, if you think about it this way, the identifiable characteristics will be replaced by sort of a number or some sort of key, which is then kept separate from the data. So it depends on who it's used by. So if data is, so if say the NHS gives a researcher access to data, they will not be able to re-identify it because they won't have the sort of the key to unlocking how that's been pseudonymized. In certain instances, like for instance with population health management, the key, if you will, to to re-identifying is typically kept separate, so that the main sort of bulk of the work is on the pseudonymized data. But then say you, out of doing that analysis, you uncover, okay, so the person with identifier XY3CH could benefit from an additional intervention. You would then be able to apply to re-identify that data in order to provide care. So it's kept separate. So the intention is that in certain instances, you might be able to re-identify if there's a proper reason to do so. However, like I said, we typically like to talk about de-identified data just to recognize the fact that it's hard to say never, never, ever, unless we're talking about sort of big picture statistical data. But I hope that helps.
Yes,
Thanks, Emma.
Thank you for the answer, but I think that also raises some other questions in a way about how does the person who's giving the data know who holds the key, if you like.
Yes, so I think so. If it's for instance, research, that will typically be, so when we're talking about having, I guess, the key, that'll be for things where we know that we might need to re-identify people, really. But right. If you're thinking about someone wants to do research on, say, the prevalence of kidney disease in the UK, they won't be sort of given access to anything that could re-identify people.
Thank you.
Excellent. Well, I'm really sorry, but we seem to have run out of time. That 45 minutes went really quickly. So I just want to round up by saying thank you so much to everyone who has participated, all of you for joining today. I love the quote that came from one of your patients, Amy, that's data is the key to better health. And I think that's a really good takeaway message for all of us and something that we can build on. And also the reassurance that what we're looking at is really trustworthy use of data in every setting. And I hope that through this series of webinars, we'll be able to build some of that and explain a little bit more about how the systems work to guarantee as far as possible that data is safe, used in a safe and secure manner. So thank you to everyone. Huge thanks to Miranda for pulling this together for us and for setting up the next series. Please do join us for the next webinar if you're available, and if not, they will be made available online. And I hope you have a lovely afternoon, everyone. Thanks very much.